Greetings. I hope everything went well for your first week with the addictions class. I know that it's a lot of work in the summer. And that's because we have a 15-week course uh, really brought down to 7 weeks, which is about 2 classes each week. So it is a lot more to do. The other thing is uh, I tried to give you not only an affordable book, but a book that was not a textbook, one that would be more enjoyable for you to read and is actually an original publication where a lot of the textbooks got some of the data from. And I chose the subject of opioids. Um, which will also be included in every class after the general lectures. Um, so I think the other thing I'd like to basically talk about is we went over the syllabus and kind of what's expected. Uh, Hopefully, you've all gotten your first discussion board completed and uploaded for week 1. Each discussion board you'll have a week to complete. So since our class is on Thursday and I do my best to upload all the D2L modules for each week on Thursday, as well as have a class, live class or Zoom, or a recorded class if you prefer to watch it that way. So you'll have a week, so try to get it in before the following class, before the next Thursday. Then I will be grading them throughout the week. So sometime the following week, I'll have your grade. And remember, like I said, what I really strive for is for you to understand the information presented. I would, rather have you rewrite something or add something to your discussion board than to give you a lower grade. My goal is for you to be successful and to understand the material so that you can help future clients to the best of your ability and better meet their needs. So that's my goal, and hopefully that's your goal too. I want to talk about a few other things. I used to use a textbook for the regular addictions course, and I do have all of the PowerPoints from the publisher. And each week I am going to upload those PowerPoints for you just to use as a study guide later on when you take the comps or the NCE. The PowerPoints are basically an outline. I may not cover absolutely everything on the PowerPoint, um, but they did base the textbook on what might appear on those larger exams, the comps and the NCE. So just use them as a study guide. Um, I'm not going to follow them myself. Each week I have various topics that I'd like to lecture on. And they're kind of the topics that I feel are most important. Some of the things this week you might want to look at either in um, the PowerPoints or in some of the articles that I provided were some of the statistics. And I know statistics change every year. The reason I kept some of the older articles, like I think the oldest one was 2017, is because that was kind of really the beginning, uh, the opioid epidemic really started growing, and gave you some stats on that. But there are also later articles, and but the statistics for population and use of every substance changes every year based on different things. Some go up, some go down, but they never go away. So I think, you know, you might want to just look in the articles, maybe look at the PowerPoints that I post for some of the stats. So the first thing I'd like to talk about is basically, why do people use drugs or alcohol? And I'm including nicotine in there as well. Technically, that is a pretty powerful drug, especially for addiction. Um, so there's lots of reasons. There's another lecture for this week that talks about comorbidity of diagnosis. So it specifically talks about people who are addicted to opioids. A very large percentage have some type of comorbid diagnosis. And the reason for that is many times people use drugs or alcohol to self-medicate. It may be something as straightforward as anxiety or depression, or trauma, or PTSD, or a troubled relationship, or the lack of a relationship, loneliness, or things like that. So they might be self-medicating to try to help them with their own symptomology of whatever they're experiencing. And so there is a lot of comorbid diagnoses. And usually drugs or alcohol do not help. They may help the individual to think that there is some relief to that symptomology and the criteria for whatever diagnosis they're experiencing, but in reality, ultimately, it usually gets worse. So another reason is experimentation or peer pressure. So people might want to try something new to see what it's like. They might have heard a lot about drinking or, some other drug, and they might want to try it. And another reason is peer pressure, and especially um, between 16 and 22, 24, lots of peer pressure for that. I know it's a lot younger now too as well, but I'm talking like the primary years. And that's because of people are getting into jobs and trying to find relationships and going to college or other schools, whatever it might be. They're moving into adulthood. They're driving. Um, so they're in the later years of high school and moving past that. So it's a prime age for peer pressure and use of alcohol, especially, and other drugs. There's lots of other reasons, but I want to talk about the primary reason people continue to use rather than just the first time. When we talked a little bit about people call things gateways, gateway drugs, and we talked a little bit about, marijuana always being tagged as a gateway drug, when in reality, the primary gateway drugs are alcohol and tobacco. Um, so, but beyond that, why do people continue to use? Well, there's lots of reasons. First of all, they get some type of emotional reaction. So, for example, if somebody is shy about going out in public with friends or going to a bar or going to a party or something like that, many substances lower inhibitions. Uh, they make people more jovial, more social, more outgoing. That has pros and cons, as we all know. Um, so it may make people more sociable when normally they would be shy. However, um, lowering impulses also leads to choices that a person normally would not make, taking risks that they normally would not take. That could be anything from um, being alone with an individual where they would normally stay with their friends. So safety issues. There are, to making choices about sexual contact and things like that. Um, so lowering inhibitions has a lot of pros and cons to it. Um, so a lot of people experience some type of uh, happiness or a lowering of anxiety or a sense of euphoria, depending on, the impact on what drug is used. Um, Sometimes it will bring people into the present so they're no longer dealing with past regrets or experiences that they don't want to think about. Or perhaps they're no longer worried or experiencing anxiety about the future or all the what ifs in life. So it may bring their focus more into the present. So all of these things are related to, levels of serotonin, levels of dopamine, a mixture of those. Um, it could be, if you're going into opioids, I have a whole lecture on those chemicals in the brain. And, you know, so when we think about it, you know, raising levels of dopamine and serotonin and other chemicals in the brain, like oxytocin and things like that, um, really has an impact on how we think, act, and feel. Um, so, in one sense, it leads to all those things. It leads to being more social, lowering anxiety and inhibitions, and perhaps not focusing so much on the past and focusing more on the present. Um, but all of these things, when we raise levels of these brain chemicals, that's a payoff. It's almost a behavioral, physical payoff. Um, and, we call all of these parts of the brain a reward center. So even if it's something simple like getting an A, oh, wow, that's great. That good grade or winning a game or a sport or um, meeting somebody new and realizing that we like each other, whatever it might be, all of those trigger various reward centers in our brain. And those parts of our brain release chemicals, serotonin, norepinephrine, dopamine, oxytocin, all kinds. And I go over them in more detail in the other lectures. But each of these has a slightly different result in our thoughts, feelings, and actions. And we we like it. So that becomes our payoff, that those change in brain chemicals becomes our payoff, our reward um, for using, basically. And eventually, we're not only trained to want that emotional reward, but we want the physical reward of brain chemical increase. And so that leads us to, uh, seeing things like cigarettes as a way to distribute nicotine. How do we get nicotine into our bloodstream, which takes it to our brain quickly? How do we get the most amount in our bodies and brains quickly? Uh, so our lungs have a lot of capillaries and blood vessels because we want to get oxygen into our bloodstream when we breathe really quickly. Every time we take a breath, we breathe in oxygen and we want that to get in our bloodstream. So, you know, smoking something brings it directly into our lungs and in contact with, all the capillaries and blood vessels. And it's a fairly direct route to our bloodstream, which then takes it to our brain. Other areas of our body also have a lot um, of blood vessels. And one would be, our sinuses. When people snort things like cocaine, it doesn't go like through our nose directly to the brain, but there's all of these blood vessels uh, there, and it goes directly into those blood vessels, and that's a really short route to our brain and bloodstream and brain. And injecting something into a blood vessel, um, the or anally, a lot of blood vessels in our colon and other areas there. Um, and that is why, uh, you know, AIDS was original. I didn't think this. I thought any contact with our blood would be a way to transmit HIV AIDS at the time. So I really didn't understand the bias with that. Everybody's a doctor. They know anything can be transmitted with a bloodstream. However, that's how that bias took place because it could be transmitted sexually because there's more blood vessels to transmit, a virus into the bloodstream. The same thing with heroin addicts who inject and share needles. That's a direct link, to the bloodstream for a virus as well. So, there's all these links and ways. Um, so there are other ways too, through our digestive system. That usually takes a lot longer to process. And it, um, our organs also filter out more of whatever substance it is. Um, so, but that's one way. We could do it sublingually, putting a pill like a benzodiazepine under our tongue and letting it dissolve and absorb that way. We could put a patch on our skin and, you know, have our skin absorb. So there's so many different methods of distributing whatever chemical it is into our bloodstream to get it to our brain to trigger the reward systems to create and release more of those chemicals that change our mood. Um, And that's why drug companies refer to these means as distribution systems. How do we get it into the bloodstream, which goes to the brain? So, alcohol, we drink it. So there's all of these different things. But let's talk about some other things that happen when, uh, people take drugs or alcohol or anything like that. So, um, I mentioned some positive things like more positive feelings, possibly. Could also bring about more paranoia. So when you have heightened dopamine and serotonin, it might actually go too far and result in paranoia. Could result in hallucinations and delusions, and um, it usually results in misfiring dendrites, which makes incorrect connections with other dendrites. But our brain thinks, hey, this makes sense. The dendrites are firing. We're making all kinds of connections, feeding that information through the neurons and processing it. And so, in one way, so for instance, marijuana results in a lot of misfires. And so dendrites are making electrochemical connections with other dendrites that they normally would not. And that's why people think they are becoming so creative when they smoke marijuana. There's so many connections and possibilities, and some of them might be interesting because we normally wouldn't make those connections. But some of them might result in things like paranoia or negative thoughts as well. So, there are a lot of negative things that happen as well. There's a lot of other medical things that happen. So, for instance, it is theorized that one of the reasons for Parkinsonian symptoms, so people with Parkinson's disease, um, like the tremors and what resembles dementia and other things, um, you know, they theorize that that is a result of low dopamine levels. So if you take something or use something that raises our dopamine levels, and you're suffering from dopamine levels that are abnormally low, you could reduce the symptoms of Parkinson's disease. So that's a limitless amount of interactions, but those are the primary things. How do we, you know, ingest or, get uh, whatever chemical it is distributed into our body and then into our bloodstream, which takes it to our minds. Then that affects neurons and dendrites and the levels of serotonin, dopamine, and other chemicals, and it has some type of result. The other thing I think it's important to mention is that without taking any drugs or medication, everybody's level of brain chemicals and neuron dendrite interactions and thought processes is slightly different. So drugs affect everybody slightly differently. So if one person has very positive experience, another person may have a negative experience on the same drug in the same amount because our brain functioning, our levels of brain chemicals are different. So, okay. Next week, we're really going to start more talking about each week. We're going to talk about a different type of addiction. And next week, we're going to talk about alcohol and tobacco and nicotine. And yeah, so each week we'll talk about something different. And I'm looking forward to reading your discussion boards. So thank you for all of your hard work that you're putting into the discussion boards. I really do appreciate it. And if you have any questions, please just email me or ask me. All right. Have a good week.